Thank you very much for all of you who have stayed around and not gone to the airport for early flights this afternoon. I was a bit worried when I heard I was the last presenter of the day, but it's great to have you all here. A connecting voice, the power of storytelling in a modern ambulance service. I'm not from a health background, I'm not from an ambulance background, but when I had come into Ambulance Victoria 15 months ago, I thought I have never worked at somewhere that has so many powerful stories to tell and so many connection points to make with our communities. What is the endless resource that everyone in this room has at their fingertips? We all think it might be a pot of gold at the end of that rainbow that you see on the slide there, but it's actually much closer than what you think. I want to start by introducing Ollie.
Yeah, it was about 4 a.m. in the morning. We woke to, he made a noise, a very strange noise we hadn't really heard before, but we thought he was just having a bad dream. He was on his front and curled up a little bit, and that's when I realised he wasn't breathing. Kylie, my wife, she rang 000 straight away, and the operator, she said get him down off the bed as quickly as you can and start CPR.
So I've alerted my ambulance community officer, Mark, and I got hold of I was able to get hold of a doctor, which was good. And we all met up and jumped in the ambulance.
So in a very small space up the fourth floor of a ski lodge, we made an arrangement straight away that I would be on the airway, and Dave defibrillated, and Dad had done really effective CPR, so Ollie was still in a shockable rhythm.
Unfortunately, the helicopter couldn't arrive because it was foggy, so it just meant we were with Ollie for 4 or 5 hours, bagging him manually.
Lauren and Dave, they did a fantastic job. It was quite some time before we set eyes on him. Everything was quite stable, so from that point of view, we're very happy.
Followed Ollie's progress along the way, and when Dad sent me a photo, and then had a bit of a cry actually, and then seeing him here today is just fantastic. A normal 11-year-old boy, it just doesn't get better.
Dad is the real hero here. He was, he knew CPR, and he did it effectively before we arrived.
It's tricky seeing him today. How do you think that you can't? There's nothing you can thank him for. There's nothing you can do.
I would encourage you now to just take it on board and go and do a CPR course, because, amazing things can happen, and Ollie's a perfect example of that. Testing.
Ollie's story was shared on Facebook alone 975 times. It was viewed 131,000 times, and it reached more than 500,000 people. Can I get one person in the audience to tell me what the main message that they took away from that video was? Learn CPR. Thank you. A very simple message that I could have done in a number of ways. I could have written a press release about it. I could have put it on our website. We could have tweeted that out. But the power of having that come through in a story like that is something that every single one of you in this room can do. So what is this endless resource I talk about? I call it finding the human, or, as my team like to refer it, getting the feels. The feel factor. Now, I know that may sound a little cheesy to you, but there is actually a strategic approach behind getting your narrative right. And that power is through people's stories. So I'm going to take you through 2 case studies today. I'm going to take you through an external case study at Ambulance Victoria, and then also how we've used this from an internal communication perspective. What does strategic storytelling mean for impact and change? It synchronises the brains of the storyteller and the listener. It can change brain chemistry. And the reason it does that, it creates that emotional connection with your audience. And what that emotional connection does, it commands attention from the people that you are speaking to. And then that can enhance memory, and then that's where we get the behaviour change that every single one of you that I've listened to over the last couple of days has listed in your presentations. How do we engage our community? How do we educate our community? How do we get our community to care about stroke, about cardiac arrest, about ensuring that they are responsible for their emergency health needs or know when to reach out and call us? At Ambulance Victoria, I think all of you would be aware, but we had a massive change to our way we triage, and through our revised clinical response model, we had to connect our community to this change because the change was quite significant. So for people who might not be exactly across what that change was, it was that we looked at our triaging system and we removed a significant amount of cases that were receiving a lights and sirens response out of Code 1 into other categories. Now, no one in this room will be surprised that government was very nervous about this. Government was very nervous about telling this story to the public because of the fear that the story could go other ways, that the story and the headlines could be Ambulance Victoria is no longer getting to people quickly and it's having negative health impacts. Tony will tell you that for 15 months or even longer, 2 years, we were doing the work behind the scenes, the change had happened, but what we didn't do was bring the community on this journey with us. So, all of you would have strategic communication teams within your ambulance services, but it's never about the communication first and foremost. It's about what business goal you are trying to support through your communications approach. So with the revised CRM, the business goal was to improve response by better aligning AV response to patient acuity. The communications goals were to demonstrate improved response times and patient outcomes, build acceptance of alternative treatment pathways for non-urgent cases, and reduce community concern by showing safety and oversight. I just want to show you animation. Oh, before I do that, connecting stories to the patient outcome. So this is where your storytelling component comes in. What we did was we selected quite a number of patient case studies that told the story of how the changes were being both safe and beneficial to the patients. The animation which I'll show you shortly was a series of animations that explained in a graphical way what had changed and why it was better for patients. That was underlined and supported by real patient stories. So it wasn't about the data, it wasn't about the percentages, it wasn't about all the changes behind the scenes that I've heard people say that's not what matters to the community. It was about finding that community connection. And then also showing real stories of minor cases which might have previously received a lights and sirens response, but under the new model received a secondary triage response or a response to nurse on call. We told these stories through the patient lens. So tying back into the theme of this conference, it's putting the patient at the centre. You can absolutely do that through your strategic storytelling approach. I'll just show you this short animation.
Every day across Victoria, 2,500 people call 000 for an ambulance. 000 call takers will ask a series of questions to determine the location, nature, and type of incident. The call triaging system, used by more than 3,000 ambulance services worldwide, quickly identifies the highest priority cases and sends an emergency ambulance. The system prioritises ambulances to life-threatening emergencies. But what happens when your need is less urgent? Until recently, too many emergency ambulances were dispatched to non-urgent cases. As a result, there was a risk paramedics would not be available to provide urgent medical care to people whose lives were at immediate risk, such as someone in cardiac arrest or with a major traumatic injury. If your call is not a time-critical, life-threatening emergency, Your health need is now assessed in more detail by paramedics and registered nurses to ensure that you get the right care. They will ask questions to find out more information about your health need and may provide an alternative option to an emergency ambulance, such as sending non-emergency transport, connecting you with a doctor or pharmacist, or providing health advice that supports you to treat your condition safely at home. Our detailed review of your case is an important safety net, and in more than 85% of calls to 000, an emergency ambulance is dispatched. When you call 000, we are assessing individual cases in more detail and prioritising urgent health needs. By better identifying patients' needs, we can provide the most appropriate response.
So, what did this mean? We engaged a journalist from the Herald Sun, which is the largest newspaper in Victoria, for those of you who are not from Victoria, and we pre-briefed on the complexity. Now, the reason that we did that was we knew that the story was simple in front of the scenes, but behind the scenes we needed that journalist to understand what that complexity was. We focused on patient outcomes. Who you're seeing here is Eric. He was a cardiac arrest patient that we had ready and lined up on the morning that told the story to the Herald Sun, and then obviously told the story at a press conference with the Minister and Tony. What Eric was able to do was be the face of these changes. He got up at the press conference and said, if ambulances had been going to other cases that were more minor than my cardiac arrest, I would not be here today. I would not be alive. In terms of any negativity that we were expecting as a result of these changes, this was a positive front page story, but not only a front page story. We had a very strong and supportive editorial in the paper that day, and therefore that led the response for the rest of the media to cover these changes. What worked, however, and my team of Ambulance Victoria colleagues in the room will know that I am always at them about not telling this story in percentages. Please, let's not tell this story in data. If you give me a percentage of a life saved and not an actual number, it is not going to work. The introduction to this story is 39 more Victorian lives were saved this year as a result of these changes. That would not work if it was in a percentage. So for those of you, it's all still evidence-led and it's all still evidence-based, but you have to make sure that it's impactful in the way you strategically communicate these issues. This was a story that we had to work hard on with government to make sure the comfort levels of putting it out. The Minister saw the animations and saw the way we were going to communicate it, and obviously then supported it and said, yes, let's bring the community on this journey. So to me, that is strategic in achieving a business goal, strategic in showing and highlighting the work that had been done behind the scenes for 2 years to make this change, and getting community support up front and centre. It's not to say that we haven't had any negativity over the last 12 months. There's always stories about, when we use taxis as part of the service offering, but I think that we have shifted the community sentiment that there's no stories about fear factors, there's no stories about people being scared that they're not getting the treatment that they need, and there's nothing coming out from a clinical perspective that would be a concern to Ambulance Victoria. Now I just want to run you through an internal communication case study on mental health and wellbeing in our workforce. So we knew our people needed our help. Only 40% would seek support for mental health within the workforce. Paramedic suicide, that won't come as a surprise to anyone in this room, was 4 times higher than the state average and 3 times higher than other emergency service personnel. The majority of our staff were not familiar with supports and the treatments that were available to them. So the communication approach. We needed to raise the awareness about training. We need to reduce the stigma in relation to people coming forward to create a supportive culture at Ambulance Victoria and encouraging an open conversation about mental health. We needed to encourage that when people were not feeling great, that they put up their hands and they sought help. I would just like you to hear from Paul.
So I guess if I look back on it, it was fairly insidious how it came across me very slowly. As I went from being very keen CI with students and that sort of thing to wanting to avoid work altogether. At the time, I couldn't even look at my uniform or anyone in a uniform. If I'd hear sirens of an ambulance, I'd start crying. All these things were going on. I was calling in sick on night shifts and sleeping in my car, and did that for 3 weeks in a row, and then I just realised that I needed to do something because it's obviously there's a lot of stories within AV of paramedics with self-harm and suicide, and thankfully I never had those thoughts, but I was aware that I was on a slippery slope and I wasn't going to get any better just doing what I was doing. One of the things that hit me while I was off, like once a month the CEO's perspective comes out as an email to everyone, and in the past I'd always read them as very clinical and impersonal, and when we got a new CEO, the first one he sent out, I read it and I was just thought, oh wow, this is a real person. And so I emailed Tony and just to say thank you. He sort of got back to me within a couple of hours and said, oh look, if you'd like to have a coffee, which blew me away, the CEO wanting to talk to, me. We caught up probably 3 times in the end over, probably 12, 14, 15 months. Just got a coffee, and each time I'd bombard him with a whole lot of notes and my thoughts and about what I'd been through, what I was going through and how I thought we could fix it. We've had a CPE day which focused wholly on that, and learning modules about mental health and how important it is within AV. And so I think that really encourages us as paramedics to talk about things like that. I think we've always known it's there but not spoken about it, whereas now at least we're talking about it, and if people are willing to just have a chat, I think the big thing is to admit that you're not right. If someone asks you or they sense something about it, don't be afraid to say, hey, look, actually I am struggling, and just talk. Speaking about it's the biggest thing.
Over a 2-year period, we've had significant progress in opening the conversation and reducing stigma. And in the last survey on mental health and wellbeing in the workplace, the majority of people said that they would now talk to a colleague about their mental health, and the majority would put their hands up and talk to their manager. So again, this highlighted for us the power of having paramedics tell the story, having paramedics talk about how they felt and how they felt supported by the organisation, but not glossing over that the journey wasn't easy. It's about telling where you've come from and telling where you've gone to and what impact that has had. I did have Good Sam in here, but my colleagues all stole my material from earlier, so I won't repeat the Good Sam story. But I just want to, touch on what storytelling has meant for AV. So our people know that they're supported and feel more connected. We have told our transformational story over 3 years through a patient lens. We've had positive media coverage and engaging community conversations. We are building stronger partnerships with our community and our partners. But more importantly, what has it meant for our patients and our community? Greater trust and confidence in their ambulance service, that it's being well managed and that they're at the centre of everything that we do. Improved understanding of what to expect when they call 000, and that isn't that you'll get an ambulance if you call through. The Victorian community now understand that, but there's trust there that they will get the right response at the right time for their individual need. Greater awareness of alternative service providers for non-urgent care, and growing understanding of how they individually can participate in their own emergency health care. Our patients and our people's stories are an endless resource. Every single one of you in this room has access to hundreds of stories on any daily basis. I don't have enough time or staff or resources to tell the stories that come across my desk. Mastering the art of the narrative can help you achieve your business goals, and ultimately sharing their stories can help save lives. Thank you very much.